In this EBMT 2025 annual meeting, I had the pleasure and honor to share a session with Dr. Mary V. Mateos from Salamanca in Spain about a very important, I think, a timely topic in the field of myeloma, namely the role of quadruplet combinations in the management both of the elderly population but also the transplant-eligible population. And to make a long story short, I would summarize everything by saying probably it should be at some point quadruplet for all. Based on the Perseus trial, I think it is now well established, more and more widely used, that the combination of daratumumab plus VRd, Bortezomib, Lenalidomide, Dexamethasone is the standard of care for induction prior to transplant. And this has been validated in the so-called Perseus trial. And I think more and more people are using this regimen for induction. When it comes to the non-transplant eligible population, in the last 6 or 7 years, we've been living with some very nice results based on the MAIA trial. And daratumumab, lenalidomide, dexamethasone proved to be an excellent and highly effective, well-tolerated regimen in the non-transplant eligible population. The great news we had in the last, I would say, 12 months was about the release of the results of the IMROSE trial, the BENEFIT trial, and more recently, the CEPHEUS trial. These trials in general included relatively old patient, but they are usually fit, in general up to age 80. And these trials established the proof of concept of using an anti-CD38 monoclonal antibody, whether daratumumab or Isatuximab, combined to VRd in this population. And there is a clear benefit in terms of MRD negativity, sustained MRD negativity, and this is translating into a significant benefit in terms of progression-free survival. And this is really great news because for the first time, we are doing better than the Dara-Len-Dex combination. And thanks to the IMROSE trial, for instance, we have now the Isatuximab VRd regimen approved and more widely used. Very recently, around mid-February 2025, we've seen the publication of a phase 2 trial, an academic trial from Norway called the REST trial. And this is very interesting because this trial tested the same combination quadruplet Isatuximab VRd in the elderly but maybe frail population. And in order to use this protocol, actually this regime, they have actually modulated the dosage of dexamethasone, and dexamethasone was skipped after 2 cycles. So, and it proved to be effective, and you have almost 40% MRD negativity. So in another word, I would say, based on IMROSE, based on BENEFIT, based on CEPHEUS, and now with the advent of the result of the REST trial, one may envision that we should use a quadruplet anti-CD38 VRd to everybody, and then in some population who are very old or frail, we may do some adjustment, a sort of a quadruplet light regimen. So you can see, I think, we're making amazing progresses in multiple myeloma, whether in the transplant or non-transplant eligible population.